Welcome back to the Bipartisan Brief. I'm joined today by Dr. Jorge Ruiz in Mexico City. And the first question I have for you, Doctor, is fill us in a little bit about how the healthcare system overall works in Mexico.
Well, first of all, Peter, thank you so much for having me in your program. It's an honor for me. And well, I think it's important for Mexican doctor to speak out what's really happening here. And well, first of all, I'm Jorge, I'm 27 years old, and I'm a physician here in Mexico City. I actually work in an ER department in a big public hospital. And well, overall here in Mexico, we have a healthcare system which works pretty much for free. I mean, everyone here is allowed to go to any hospital, and you can ask for attention without having to pay anything. More important nowadays with the COVID-19 thing, every hospital, it doesn't matter if it's private or if it's public, it's for free. So that's amazing. I mean, for a point of view where we are a third world country, I mean, that's great because anyone, it doesn't matter if you have the money or not, you're gonna get the right attention, the right medical attention.
So a follow-up there. So
yeah.
if it's, of course, nothing's free, so the taxpayers are funding it. The government's funding
Yeah,
it.
of course. Yeah.
In that situation, does that mean, like, for example, in England and Canada, my understanding is that a lot of the doctors get their paycheck from the government. Is that the system here, or is it more mixed between private and public?
No, just like that. I mean, we get paid by the government. We're actually public persons. I mean, we work for the government. That's right. Well, if you work in a private hospital, yeah, you get paid by that company. But that's the difference here. I mean, for example, in the US or I mean, anywhere else, you have to pay for an insurance, and you don't have to do that here. I mean, you get insurance by the government if you're working, because if you're not working, I mean, you don't get access to public health. That's the thing here. But with COVID-19, it doesn't matter if you have a work or not, you're gonna get the attention.
So a couple of follow-ups there.
Yeah.
This has been a problem in the US where we have, for example, we had a $1,200 stimulus check, but you had to meet certain qualifications in order to receive it. Or with the unemployment benefits, of course, you had to have been employed in order to receive unemployment if you get laid off. So, for example, there's so many people who are working, but they're more in the street or cash economy rather than a traditional 9 to 5. So I wonder about, like, all the street vendors. Are they covered, or are they an unprotected class?
No, they cover, man, and that's amazing. I mean, I believe that that's great because, as you say, I mean, 50% of the population here works on the streets. I mean, they sell things or they prepare food, I don't know. But yeah, I mean, they can go to any hospital in this moment. They can go to any hospital and they're gonna get the proper attention. Yeah, it doesn't matter if they're working or not.
Yeah, so I know in this moment, the government's stepping up, even in the US, where, of course, we're very, where a lot of the powers that be are fiercely protective of our private system. Even 2/3 of the Democrat senators are against universal coverage or Medicare for all or socialized medicine, whatever verbiage you choose to use. But right now, the US does have socialized medicine. We're covering COVID cases.
Nice.
I'm curious, independent of COVID, do the street vendors get coverage generally, or do they have to have, is there some other system for those folks, or how does that work?
Yeah, there's another system, but they cover. I mean, basically here in Mexico, we have two types of medical coverage, per se. We have private coverage, which you pay an insurance to any company, I don't know, any name of any insurance company you want, and you're gonna get private facilities. But if you are like 99% of the people here in Mexico, which we don't pay for an insurance, we get public health. And in public health, we have three big institutions, which is IMSS, Instituto Mexicano del Seguro Social, which is the biggest one, and the better one, if I may, we have ISSSTE, which is another kind of public health. We have the ones that are provided by the government itself, which that one is the one that cover everyone. I mean, if you don't have work, if you're in the street and you need to, I mean, anything, you can go to those hospitals and you're going to get the attention and you don't have to pay for anything. So yeah, that's in a scenario where we don't have COVID-19. Yeah, you're still covered. So that's great too. But you can't go to a private facility, or you can't go to certain hospitals, but you still get covered.
I think that's very similar to Medicare and Medicaid, the public, and for that matter, the VA, the Veterans Healthcare Administration, where you have coverage, but you can't necessarily pick exactly.
Yeah, that's right.
List you go to. I'm also curious, one more follow-up before we move on, and you may not know this exactly off the top of your head, but what is the breakdown? Like, I think in the UK, it's something like 10% of the healthcare system is private, 90% is public. Of course, in the US, it's more like the other way around. Do you know that off the top of your head, or do you not?
I don't know the exact number, but if I have to guess, I think it's 90-10. 90% public health and 10% private facilities. I mean, yeah, 1 out of 10 can't pay for an insurance here in Mexico because it's not something we do.
Got it. And so now I'm curious, moving on.
Yeah.
What are you seeing with your own eyes? You're working in the hospital system. Are they at capacity or near capacity or over capacity, or is this thing trending in a good direction or a bad direction? I'm curious to get a firsthand account of what you're actually seeing and what you're hearing from your various friends who are in your profession as well.
Yeah, well, getting in this topic, fully talking about COVID-19, it's a thing that in Mexico, we start to see late. I mean, the first case that I saw here, it was around probably April. And well, that's 2 or 3 months after the first cases in Europe. So we weren't prepared at first, but right now, things are getting much better. A couple of weeks ago, I'm talking about early May, late April, we had, I mean, tons of patients, severely affected. I mean, they have some severe conditions, but right now the things are getting much better. And I think that one of the main reasons this is happening is because the government is doing a great job, man. I mean, they are hiring tons of doctors, tons of nurses. I mean, everything is going well. They're opening hospitals everywhere. So yeah, we're working at max capacity. I mean, that's a fact, but we're not yet over our head. So that's great. I mean, the government is doing a great job despite everything they're talking about. But I mean, I think we're handling well.
And you said they're building hospital capacity. So like in the US, they were building out in convention centers and hotels. Same thing here. They're using hotels. They're using to develop excess capacity.
Yeah, we actually, well, the government is actually building, or they built one big hospital at Autódromo Hermanos Rodriguez, which is a track race. And it's great, man. I mean, that's one. They build like I don't know, 2 or 3 hospitals only here in Mexico City. So yeah, I mean, we're doing that. And the main thing, though, the main strategy that we did here in Mexico is that the biggest hospitals here are fully dedicated to see COVID-19 patients. I mean, we don't see anything else. We only see these patients. So that gives us a big room of working, so we can only see these patients and we don't have to distract with other things.
You know, the follow-up there is, and we've seen this, I've heard this and I've read this, that in the US we have a similar policy, and that with the benefit of hindsight, because of course we were affected severely in the US long before we were here. in Mexico. I say we both times because I am an American, but I live in Mexico and I love it here.
Yeah.
And there were some backlash, may not be the exact right word, but there were some unintended consequences of over-focusing on COVID, and people who heart patients and cancer patients who were not necessarily able to get the treatment they needed. And we kind of had to walk a balancing act. And it seems almost like, to a certain extent, political leadership globally has almost said that a death from COVID is worse than a death from cancer or something like that.
Yeah.
As far as that goes, how do you feel about that sentiment? And do you think the Mexican government's doing a pretty good job of balancing that?
Yeah, man. I mean, I have to say that I'm impressed. At first, I was a little hesitant. I mean, I hesitate about what the strategies of the government were, because I mean that came to my head immediately. I mean, where are cancer patients going to get the treatment? Heart patients, chronic patients, diabetes. I mean, we have a lot of that here in Mexico, but they're getting the treatment, man. I mean, I guess that 50% of the hospitals are entirely dedicated to see COVID patients, and the other 50% is dedicated to see all the chronic diseases like cancer, diabetes, heart problems, all the things. So, yeah, man. I mean, I'm impressed. I have to give it one to the Mexican government, because they're doing a great job with that, man.
Well, so you work at a COVID dedicated hospital, but other hospitals are set aside to make sure that you guys, because I was hoping, as I watched this unfold in the US first, I was hoping that the Mexican government would learn lessons from our mistakes. And so it sounds like, at least to a certain extent, they have. Speaking of, as recently as maybe 10 days ago, a good friend of mine is a nurse, and she was explaining to me that there are still serious shortages in the US in terms of the personal protective equipment. She said that she's been asked to reuse her N95 mask for multiple days in a row. What's the situation in terms of the protective equipment in Mexico? The face shields, the goggles, the gloves, the N95. Yeah. Are there shortages here, or are you guys pretty well stocked up?
Well, once again, I mean, I'm impressed. I mean, and I say this so many times because I was hoping for the worst. I mean, we're Mexico, and we have this thing that, well, we didn't do the things the right way. We're only short of this or that. And in this case, from day one, I have all my equipment. I have N95 mask. I have my goggles. I have my gloves. I have I have all the equipment. But that's in my hospital. And I have to say that my hospital is a big hospital, and it's a great hospital. But there are some guys that are not getting enough equipment, so they're struggling. Some, some even have to get their own equipment. But I mean, I guess it's depend of the hospital, man. I can't complain about my hospital. It's a great hospital, but yeah, some folks are struggling with that.
Because I was going to ask you if you have friends who are struggling to get the PPE.
Yeah, I have.
Because that's it's been the disparities that exist probably globally, but certainly in the US, where I have more friends in this profession than any other country. And it really is a case where one hospital is well stocked and one hospital is not. And I don't know if that's a question of the individual leadership at the hospital or if it's something else. I guess it's kind of hard to tell. And I was also thinking when this first started, I was seeing a lot more masks on the street here than elsewhere. And I kind of thought that perhaps one difference between Mexico and the US is that in Mexico, we still make things here, whereas in the US, we don't make anything. So because of that, Mexico may not have had to rely on China to the extent that the US did. And that might be a factor as well. I don't know. What do you think?
Yeah, I mean, that's more a political thing, but I believe that we're getting things from China because actually some of the masks we're using come from China. But I mean, especially the mask, because from all the personal protection equipment, the mask is the main thing. And yeah, we're getting some from China, but we still have some here. And yeah, I mean, like, I guess this happened all over the world. There are some hospitals that are going to be better. There are some hospitals that are going to have more equipment, and there are some hospitals that are going to have some missing things, and that's what happened right now. But I can't talk about other hospitals. I can only talk from what I see, what I'm living, and the things for us are going well. I mean, we have everything we need. We have all the equipment, so that's great.
I've been paying careful attention to the numbers, and the cases this past week compared with the previous week, the cases went up about 30%, but the testing capacity went up 60%. So
Yeah.
obviously you want that ratio to be the higher the better. In Mexico, it's about 2 to 1. But the deaths this past week versus the previous week, nationally I'm talking about,
Yep.
went up 30% compared to a week ago. But you're saying in Mexico City, which has been the hardest hit place, things are sort of settling to a certain extent. What are you hearing from your friends outside of Mexico City? Is it getting worse in other places? Does that explain why the numbers to a certain extent are getting worse, even though what you see with your eyes is that things are getting better?
Yeah, well, things are getting worse in big cities. That's a reality. I mean, we're talking about Monterrey, Guadalajara, Veracruz. I'm actually from Veracruz, and in Veracruz, the cases are getting higher. I mean, they're getting more cases every time. The deaths are going up. So it's something that is happening. But here in Mexico City, the deaths are also going high. I mean, they're getting every time more cases. Some of that is because we're testing more. That's a reality. We're testing more, but we're not testing enough. That's also true. I mean, the numbers that we see on TV or that we see in the papers are not entirely right. But it's a correct estimation as we see in the news. It's only an epidemiological model, so we can estimate the entire number of cases that we're having.
Yes, and when I said deaths going up, I didn't mean the total. I meant the comparative percent week by week.
Oh, yeah.
Right. So it sounds like you're saying that to a certain extent, because Mexico, of course, being the major international hub and the biggest city with the most public transportation, the highest population density, you're saying Mexico City probably got hit harder quicker. And so the national numbers that might not look so good are probably due to the cases spiking in Guadalajara, Monterrey, other major cities. What you're seeing with your own eyes is that things are stabilizing, at least to a certain extent, in Mexico City. Is that accurate?
Yeah, it is, but I think that it's also relative. Why? Why I say this? Because a couple of weeks ago, when this thing started, there were only a couple of hospitals dedicated entirely to COVID-19. Talking about, I don't know, let's say 10 hospitals that only see COVID-19. And right now, we have 20 hospitals that see COVID-19. So that explained why in my hospitals, the cases are going down, and we see every time less patients because there are more hospitals. The capacity that we have in our healthcare system is getting bigger. So that's making that things get much better for us. But the cases are going up. I mean, that's why I say that this is relative. I see the things are getting better, but it might not be so true because there are more hospitals and the patients are going to different hospitals instead of only one hospital.
Oh, that makes complete sense. So
yeah.
To sum it up sort of succinctly, you could say that things are still bad and things are still dangerous. The government response has been such that that your hospital is not busting, breaking down the way it almost
exactly
was maybe 2 weeks ago.
Yeah, I mean, 2 weeks ago it was horrible, man. We had 60, 70 patients in the ER. We have 200 patients in hospital bed. So I mean, it was like war. I mean, I can't explain the feeling of that. I mean that we even had to reject some patients in some times because we're full. We can't see a patient if we don't have a bed, if we don't have oxygen. I mean, we didn't have oxygen, so that summed up everything. But right now, I mean, the government, I guess, that saw that and open up so many hospitals and amplify our healthcare system capacity, and we're doing much better. So yeah, patients are getting the right treatment.
So I know that you're a doctor, not a mathematician, and you're not Nostradamus, the famous prognosticator, but I am curious because you have firsthand knowledge. Give me your outlook for the next several weeks, several months, as far as what you see the trajectory of the virus in Mexico City being.
Well, I guess in a couple of weeks, maybe 2 or 3 weeks, things are going to go flat. I mean, this thing about going high or going down, I guess the 2 or 3 weeks we're going to go in a plateau, and after that, it's going to start to getting down. But we're still going to have cases. I mean, we're still going to have a lot of patients, but I think we're going to get a peak in a couple of weeks. So
you feel like by maybe mid-June, Mexico City will be out of the woods, at least to a certain extent. Of course, the virus is still going to be here. It's still going to be dangerous. But the risk of the entire healthcare system being overwhelmed, you think will probably be in the rearview mirror by maybe June.
That's right. Yeah, and to keep that comment, the real dangerous thing here is that our hospitals don't get enough room to see the patients, and we are out of danger there. We're clear, so we don't have that problem anymore. And I don't think we're gonna see the things that we're seeing in South America or some places in Europe, in Italy that happen. I mean, we're not gonna have that. The virus is gonna still here. The virus is gonna go much more contagious. But our hospitals are gonna be just enough. It's gonna be enough to see all the patients.
That's really encouraging to hear. Last question, it's a two-part question. One, what do you think are some of the mistakes in terms of public policy as it relates to healthcare that the Mexican government, and not just the government, but leadership in general, what were some mistakes policy-wise you think were made early on? And then what are some policy recommendations you have moving forward to try to keep things on the right trajectory and to hopefully try to get back to as semi-normal of a life as we can possibly be leading?
Yeah, I think the first mistake that we made here is that we weren't ready for this, or we weren't ready for anything talking about healthcare system. I mean, we have a deficiency with healthcare workers. We don't have enough doctors. We don't have enough nurses. And not because we're not here, because the government, I mean, they don't hire enough people. So that's come from years, I mean, decades. We're talking about something that started, I don't know, in the 60s, in the 70s maybe, and we're still suffering for that. So what the government did right now was to hire everything, and to hire everyone. And that's a reality. I mean, they hired me a couple months ago, and they hire, I don't know, probably thousands of doctors, nurses, and not only us. I mean, technicians. I mean, they hire lots of people. So what I think that the mistake was here was to not be ready and maybe not thinking in the future that this might happen. And a mistake now would be to fire everyone, or when they contracts end, to let the people go, because it's gonna be the same, but only without COVID-19. I mean, if it's not COVID-19, it's gonna be heart disease, it's gonna be diabetes, and the healthcare system is gonna be full, and it's gonna be the same thing, but only that without COVID-19. So if they still have enough capacity, enough money, I don't know how politics works, but if they can keep most of the people, or at least 50% of the people that they hire, things are gonna be like 100% better. So I hope that that's something that the politicians have in mind, and maybe that would make a difference here.
And my last question is, I'm curious because I don't necessarily understand the Constitution here in Mexico. If a doctor, not even you, don't make it specific or personal. If a doctor really spoke out aggressively against the government, would they be in trouble? Would they lose their job? Would they, like, for example, in the US, it's complicated because of the Free Speech First Amendment. You're not supposed to be able to fire a government employee who's a whistleblower or who speaks his mind. What's the situation like constitutionally on that topic here in Mexico?
Well, it depends a lot of where you work, because some of us have some confidential agreement to say something, which is your contract. I mean, you can't talk about or discuss about patients or things like that. But we're actually pretty free. I mean, I can talk about anything I want about the government, but as anything, I mean, not only us as healthcare workers. I mean, in any aspect in Mexico, if you talk bad about the government, you have to know that you're gonna have some repercussions. I mean, you can't do it that free. So you have to be careful. But right now, I mean, I have to say that there's nothing wrong right now. I mean, and that's great. I mean, I have absolutely anything to say bad about this government at this right now, or at least about COVID-19, because there are a lot of things that we can talk about politics and how this new government is acting. But in this scenario where we're fighting such a big problem and such an incredible situation, which is COVID-19, they're doing an amazing job. And someone had to say it, because people are getting trying to say that the government is doing the things the wrong way and this and that, and maybe they're not doing it great. I mean, some countries have definitely doing things better or did things better, but for us, I think we're doing just a great job.
Yeah, especially it sounds like if you compare your concerns with what the reality turned out to be, the Mexican government's response has really been outstanding. Yeah,
man. I mean, I thought that we're going to be like zombie movies. I mean, that we're going to have people dying on the streets, which is not something crazy to say, because this is happening in South America. I mean, we start to see dead people on the streets. We start to see doctors working without any equipment. And well, I mean, that's horrifying. And I was hoping that to happen here in Mexico. I mean, at the beginning of the pandemic, I was hysterical. I thought that everything was going to go down, that healthcare system was gonna, I mean, I thought everyone gonna die. And that didn't happen. We are responding nice. And as you said, comparison to what I thought that it was gonna be, this is 1,000 times better.
Well, Dr. Ruiz, I look forward to when there's beer again in Mexico and the bars are open and life's a little more normal. I'm definitely going to take you out to Chile 1 or 2. And I really appreciate your time. And hopefully we'll have you on maybe sometime in a couple of months as an update as this thing keeps progressing here in Mexico. And again, thank you so much for your time.
For sure, Peter. Thank you. And have a good one, man.
Hey, brother. That was great. I'll send you the recorded, the full thing.
Yeah, please.
Okay. And, but that's really good. I think that my people are going to be hearing from I'm supposed to be getting on with a nurse in Brazil the next couple of days.
Yeah.
You know, it's quite bad down there, you know, and I knew it was going to be bad here because, you know, I'm so happy to hear that the government has not been fucking terrible in terms of the specific health response. Because Andrew was the same as Trump for months. He thought it was a public relations problem, not a fucking health problem. I mean, he was an asshole for like 2 months, just like Trump. You know, going to rallies, kissing babies, like, what the fuck are you doing? You fucking dumb fuck, you know? And this is not going to go on the show, by the way.
No, no worry.
But the four main factors, because I look at the U.S., because of course I pay attention there. Heavily used public transportation, Mexico City, check. Okay. Just like New York. Okay. High population density, Mexico City, New York, check.
Yeah.
An idiot for a mayor. I cannot believe Claudia is letting people sit and eat street food. You know those plates? They put wax paper food, they hand it, you eat, you give it back, wax paper in the trash, they wipe it down, they hand it back. Every street food place in the city might be passing out 50 cases of COVID a day.
Yeah, easily.
The fact that she won't order street food to be served to go is just absolutely fucking insane to me. And then the other thing is, she still hasn't ordered people to cover their nose and mouth on the fucking subways and buses. Like, even, I mean, I'm not shitting you. Even if it's a fucking t-shirt you hold,
yeah,
it helps. It's not going to help you from getting it much, but it's going to help you from spreading it. Because they say like 2/3 of the people are asymptomatic, right? And so like an asymptomatic person who doesn't have if even a cotton t-shirt over your nose and mouth, if you're an asymptomatic person, the odds of you giving it to somebody else, they go down by what? 60%, 70%. Like there's no reason not to do it. And my apartment's right by a bus line, and maybe only half the people on the bus have their face and mouth or their nose and mouth covered. And I'm just hard, like those two things. Street food should be prepared to go. Everybody should cover their nose and mouth on public transportation. Like just those two things, I think you'll cut the infection rate moving forward by half. And they don't cost anything. They don't cost anything. Like that's the other part, right? A lot of the measures I'd advise, like all the street food workers to have an N95 mask, well, who's going to provide that, right? But just to say it's got to be served to go, and you got to do this with just even a piece of cloth on the buses and subways. Like, I cannot believe she hasn't done that. And
yeah, and don't get me wrong, man. And you can use this in your video if you want. I'm not saying that everything the government is doing, it's right. I mean, the thing that everyone's on the street, people are acting like if anything is happening. I mean, this thing is only gonna get worse if people don't understand what's happening right now. I mean, we're fighting something that we don't see from years, decades, even centuries, and people aren't getting that. The government is not getting enough. I mean, they're getting harder with the policies. I mean, they should even demand to people stay at home, that they don't use public transportation, that they use right measures of protection. But people don't care. What I say is that we are ready. I mean, as a doctor, as a healthcare system, we're ready, and we can't fight this. But people are gonna get sick, and people are gonna get real bad. But I mean, what I have to do is to see this patient in the hospital. What I need is my equipment. What I need is my medicines and my oxygen and everything. And that's right. I mean, I have enough. But people are gonna still getting sick. And if the government doesn't do anything like immediate or something hard, something that have actually, and I mean, something to make people understand what's happening right now. I mean, because even people are seeing that they're dying, that their families are getting sick, and they're doing absolutely anything. So yeah, that's completely, I mean, amazing. That's awful.
yeah,
But
there are a lot of people here not taking it seriously enough. No question about it. And I think same in the U.S. It's because the president didn't take it seriously. His public posture was everything's okay, hug me, kiss me. I'm gonna
same thing happened here in the first.
Yeah, I'm gonna give El Chapo's mother a big hug, even though she's an elderly lady who's at heavy. He should have never given an elderly person a hug during this thing, considering their death rates are I've read as much as 75, 100 times higher than young, healthier people. But I'm really glad to know that in terms of healthcare specifically,
exactly,
gotten off their ass and helped. But like you talked about the lockdown order, you can't do that here because 2/3 of the people, probably 1/3 of the people in Mexico City, or maybe a quarter, don't even have a bank. And then another 50% don't have any money in the bank, any savings. And so these people need to get to the street to sell their knitted purses or whatever the case may be. They have to eat. And Mexico doesn't have the resources to just give, like Canada's giving every Canadian citizen 2,000 Canadian dollars a month. Okay, well, I don't think Mexico can do that. Not without totally collapsing the currency. So like China said, you're all at home or else. But then China has the resources to drop off bags of food at everybody's front door, right? And China has the police military authority that the citizenry is very scared of them, but here, like, the people need to leave the house to go make money with their families. I just wish that, like, I get it. You can't shut down public transportation in this city. You should have in terms of health alone, but then you have different health problems like food insecurity and borderline starvation, right? And so, like, these are big problems as well. And so I cannot believe that they're not requiring street food to be served to go, and that they're not requiring noses and mouths to be covered on the subway. Because again, those are policies that cost the government nothing, that would make such a tangible difference. I don't fucking get it. I'm so frustrated with Claudia because those are two really obvious steps that would make a serious, dramatic, tangible difference that cost the government not one single penny. And the only thing I can think of to explain it is that, and to your point, by the way, this week, I've heard fewer ambulances. 2-3 weeks ago, I would hear an ambulance every 40 minutes. Now I'm hearing an ambulance every 2 hours. Now, before this started, I was hearing an ambulance maybe twice a day, right? So I've kind of seen with my own eyes what you've been describing. But I'm really, what you said earlier, that it's a war. There's a phrase called the fog of war, which means that when you're in a war situation, making clear-headed, well thought out, proper decisions is oftentimes simply impossible, because you're dealing with the weight of the world on your shoulders and there's too many moving parts. And Lord knows with this thing, there are no easy questions and no right answers. And so I think probably she's just under so much stress and not sleeping that she's not seeing the really obvious things to do. I've tweeted at her like 40 times. Would you please order the street food be served to go? Would you please require noses and mouths to be covered on subway? But surprise, surprise, she's not listening to me. But but man, I can't wait till shit opens and we get a beer together.
Hopefully, man. Thank you so much for this, and I wait for the video so I can post it also in my YouTube page.
Send me your email so that way I can send it to you.
Nice. Okay.
The file is too big to text, I assume.
Sorry, what?
I said the file is going to be too big to text.
Yeah, it's gonna be huge. So I'm gonna give you my email, and
that sounds great, man. And keep fighting the good fight. And as a
thanks so much for
Mexico, I definitely appreciate all you're doing to try to keep people safe and most of all alive. And so I appreciate you, brother, and we'll talk soon.
Thank you so much for take care of yourself and be safe, man.
Thanks, brother. Cheers.